Hi, you guys. Welcome back for our daily practice questions. It's day 10 with our practice question series. But y'all know first, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And quick update for those of you who have registered for the 5-week review course that starts on Monday, the 13th. The emails for the access link goes out today. So make sure you are looking for those emails from the nursing studio. They will go out today and you'll be able to see, and all the instructions are in there. And I look forward to working with y'all, but let's get into our questions. Question number one: which of the following conditions is most commonly associated with the presence of cotton wool spots on retinal examinations? Is it A, diabetic retinopathy, B, hypertensive retinopathy, C, glaucoma, or D, macular degeneration? Take a moment and tell me what you got, y'all. All right. Y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. But here, the question is the stem is question, right? So, which of the following conditions is most commonly associated with the presence of cotton wool spots on a retinal exam? And the best answer is A, diabetic retinopathy. Although diabetic retinopathy and hypertensive retinopathy are both associated with cotton wool spots, diabetic retinopathy is the most commonly one that is associated with it. The most common one. Question number two: what is the underlying pathophysiological mechanism that leads to the formation of cotton wool spots in the retina? Is it A, retinal hemorrhage? Is it B, retinal microinfarction due to occlusion of retinal capillaries? Is it C, thickening of the retinal blood vessel walls? Or is it D, fluid accumulation in the macula? Take a moment and tell me what you got. All right. So here, same thing. Stem is the question. Question is the stem, right? So what is the underlying pathomechanism that leads to the formation of cotton wool spots in the retina? So what's the patho? What's causing these cotton wool spots, right? Is it A, a retinal hemorrhage? No. Is it B, a retinal microinfarction due to occlusion of retinal capillaries? Yes, that is your best answer. So, same as when I was telling you about AV nicking, let's talk about cotton wool spots. So, cotton wool spots, again, this is vessel damage that is going on, right? So, when we have uncontrolled blood pressure, uncontrolled glucose, these things have wear and tear on our bodies. This is why high blood pressure, diabetes, hyperlipidemia, all of these things are cardiac risk factors, right? Because it is damaging the vessels in your body if they are left unmanaged and treated, right? So, no different than the vessels in your eyes. Now, as this is more commonly associated with diabetes, but all of these things are still putting wear and tear on those vessels in that retina. So, as that retina wall begins to continue to deal with all of the damage and the wear and tear on its vasculature, what happens is these tiny little vessels have tiny areas that become blocked and they have infarctions, right? No different than AMI, right? But these are just more, as the word says, micro. They're small areas, and where those spots are, it leaves off and gives us this like white appearance where you can determine and see that those blockages have occurred. And that's where the name cotton wool spots come, because those little white spots that begin to appear look like cotton, right? So that's where the name cotton wool spots. But again, it's the same scenario with AV nicking. It's damage to the vessels that is leading to this. But with cotton wool spots, it's completely having an occlusion that has caused a blockage and caused an infarction, which appears white when this happens. So B is your best answer. And then lastly, question number 3, what is the most appropriate treatment approach for a patient with cotton wool spots due to diabetic retinopathy? Is it A, laser therapy, B, tight glucose and blood pressure monitoring, C, surgical repair, or D, observation and follow-up? Take a moment, tell me what you got. All right. So, what is the most appropriate treatment approach for a patient with cotton wool spots due to diabetic retinopathy? And your best answer is B. You want to tightly control that glucose and blood pressure. Again, diabetic retinopathy and hypertensive retinopathy are the main causes for cotton wool spots, with diabetic retinopathy being the most common one at the top, okay? So if you run into a question like this on boards, they're typically going to just group it all together because they know that all of these are associated. But if they say the most common, then you know it should be diabetic retinopathy, right? But we know in the management of this and in all of our eye issues, we want to make sure that we are controlling this hypertension and the diabetic, the glucose and blood pressure control needs to be managed, not left untreated or uncontrolled for prolonged periods of time because it continues to cause wear and tear. All right. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, as always, feel free to contact the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number 1 at gmail.com. All of the things that I do offer are linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions or custom packages, I always say either call, text, or email, as I prefer to speak with you first to gauge what you really need so that you can make sure so that I can make sure that you're booking the most appropriate session type. And some things for the links that are in the bio, it's for my review book. So there's 2 options you will see linked there. The review book, you can get the paperback option, which will take you to the Amazon store where my review book is housed, as well as if you're trying to get the ebook link is on there, and they're marked both ways, paperback versus ebook. The paperback, if you're someone who wants the book and is tangible, you want to be able to write in those interactive sections, because remember, in each system I have interactive sections level 1, 2, and 3 that test your recall on that assessment, diagnosis, evaluation, treatment that I always teach on. Now, and it has that as well as the practice questions in the back. Some people like to write in the book. I'm a writer, but I also offer it in an ebook fashion because I also like to study on the go so that you can use it on all device options. So whatever your preference is, I have them linked there both ways. So just to explain that, because I have received questions on that. And the rest of the things are the QBank options, the digital flashcards. And then, like I said, if you're looking to book any of the one-on-one sessions, just reach out by either calling, texting, or email, and I will be happy to assist you, okay? All right, you guys. As always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.